Hello, my name is Paige Scott. I am an ISM student here at Lone Star High School, and I am studying physical therapy. So, in the beginning of the year, we had to choose a quote that we thought would best suit ourselves and our profession, and mine was, enjoy the little things in life, for one day you'll look back and realize they were the big things. For me, this is huge because I didn't think that, injuring something in my body would cause me to, take it for granted. Like, I tore my ACL and I couldn't walk for a good 2 months, and it made me realize, I could have it worse, but I'm good. So, okay, what exactly is ISM? Independent Study and Mentorship is a rigorous, challenging course offered at Frisco ISD high schools. This program is designed for academically gifted and high-achieving students who are juniors or seniors. Students who want to take ISM go through a selection and application process and are chosen to participate in this exciting, rigorous elective. They select careers or topics of study, and the ISM teacher helps students narrow down and focus this topic of study. Students conduct informational interviews with professionals in this chosen field, and from this process they carefully choose a mentor with whom to work for the remainder of the year, and then it's usually the second semester. The ISM teacher guides and helps students with this important interview and mentor selection process. The course includes intense research, original idea, original product design, and written analysis of research. Furthermore, the ISM teacher works with students on professionalism, time management, effective oral and written communication, interpersonal skills, interviewing, resume writing, and goal setting to help prepare these students for success in their mentorship experience and in life after high school. The ISM teacher follows each student's progress closely, communicates often with mentors, and makes sure each student stays task committed. So this is pretty much an overview on what we've had to go through in the ISM class. Junior year, we had to fill out an application, and then we had to get interviewed. So we weren't just, put in the class. We actually had to earn a spot. We also had to come up with a mission statement, and mine is to provide lifelong lessons to athletes recovering from injuries by allowing them to push past their personal limits and struggles, showing them that the once impossible can be conquered. This is important to me because I know when I was in therapy, I thought it couldn't get any worse. I didn't think I'd be able to overcome my injury, and physical therapy really helped me overcome that obstacle and teach me that it's not the end of the world and everything's going to be okay and get better. Why I took ISM. I took ISM because I wanted to get a head start on choosing a career. With this process, I would be able to determine if the path I thought would interest me was correct, and if it wasn't, then it would potentially save me time and money in college. It would also get me out of my comfort zone and push past some of my personal limits. For me, the big thing here is pushing me out of my comfort zone. Public speaking is not something I'm very good at, and this class is good at making me feel uncomfortable at times, but I know it's worth it because it's a lifelong skill that I'll need later in life. And it also helped me with time, because through this process I was able to learn a lot about the profession and some things that I didn't know about it, and it would help me, save money in college if I decided to change majors, switch back and forth. Okay, what exactly is physical therapy? Physical therapy is the treatment of disease, injury, or deformity by physical methods such as massage, heat treatment, and exercise rather than by drugs or surgery. So most people go to physical therapists if they, injured an ankle, sprained an ankle, had surgery. And a lot of the times you hear people going after surgery, but it's a lot of the times people go to prevent surgery because it's cheaper. Okay, what is the job of a physical therapist? Physical therapists teach patients how to prevent and manage their condition so that they will be able to achieve long-term health benefits. PTs examine each individual and develop a plan using treatment techniques. So, you usually get a piece of paper, multiple pieces of paper, that give you exercises that you need to do to help strengthen whatever's injured, to help set you back on track to, getting to a normal everyday life. Okay, why physical therapy? I've always had an interest in helping athletes. I knew I wanted to do something related to sports, and like I said, it took about 4 months for me to figure out that I wanted to do physical therapy after my injury. First, I was like questioning, why did this happen to me? Because I never had an injury up until this point. And the 4 months it took me to get through, a lot of the injury taught me to never take anything for granted, appreciate what you have, because tomorrow is not guaranteed. You're not guaranteed to walk, you're not guaranteed to talk. You're not even guaranteed to be here. So, okay. And then for me, I was debating whether or not I wanted to do physical therapy or athletic training. Since I have been a trainer here at Lone Star for 4 years, it was good to get another side for the physical therapy, because I had the physical therapy for my injury, but then I also had the athletic training experience from being a football trainer and a basketball trainer. So the big difference is physical therapy, you now need to get a doctorate, and athletic training, you just need 4 years of college. And for physical therapy, you don't travel as much and you stay rooted, because oftentimes the offices are like in clinics. And for athletic training, it's harder to find jobs and lots of traveling, which I don't think I want to do. I want to stay rooted and, for family. Okay, these are some things you may see. Since a lot of my research consisted of knee injuries, I decided to do what you would see for knee injuries. So this is an immobilizer brace. You usually get this after, MCL surgery, ACL surgery, PCL, all the major ligaments of your knee. This brace is designed to help restrict your range of motion. Okay, and then this usually get the day after, or the day of surgery. You set it up anywhere, usually in your bed, and you put your bad leg into this little slot right here, and it bends your leg for you, so you don't have to bend it back and forth, which it's very beneficial because it's useful to get you back on track faster. Because I know if I didn't have this for my injury, it would take me a lot longer to, get up, move, walk around. Okay, this is called a STEM machine. A lot of y'all probably see it here at Lone Star. We have it in the athletic training room. STEM is used to help. STEM is used to help you get back on track faster, and then also there's an ultrasound on this machine to break up scar tissue. Okay, these bands you'll see pretty much for any injury, but they range from colors like red, yellow, green, blue. No, they're just not color. They're not color. They are color coded because, like the green one is less resistant than the blue one, and the red and yellow one are less resistant than the blue one as well. Okay, this is kind of corny, but I kind of wanted to put it in here. So it's the laws of physical therapy. Number 1, never say you can't, because you'll do it anyway. Never say it's easy, because we'll just make it hard. Never say I want to go home, because you'll just stay longer. Never lose count, because you'll start over again. Never complain, because we never listen. Never argue, because you never win. Never scream or cry, because it only encourages us. Never look like you're enjoying it, because we'll put a stop to it. Never hold your breath, because if you pass out and die, we will have to fill out all the paperwork. Never lie or cheat, because we know the truth and you'll live to regret it. So this is pretty funny because it's true. When you're in physical therapy, anything that seems easy, they change it because they want you to struggle. They like seeing that because it means progress. Okay, what makes a good physical therapist? A good physical therapist, you have to have good communication skills. You have to be a people person. You have to enjoy what you're doing and know that each person's pain tolerance is different. For me, I think one of the most important ones is the last one, knowing each person's pain tolerance is different. Because you could have two 14-year-olds with, ACL injuries. One could be back up in their feet in a month, and the other one could take longer, 2 months. So it all depends on the person, not the injury. Okay, so for my research, I was able to see how much physical therapy has changed over the years. What used to require a master's degree, now you need a bachelor's degree, and then now you need a doctorate. And I was also able to find out how diverse the locations are, because I didn't realize, I thought that a lot of the physical therapies were in clinics, but turns out most of them are in hospitals. And then it's crazy to see how much the program has evolved over the years and how complex it has gotten. What first started off as just needing a master's degree is now a doctorate. When people think of physical therapy, not a lot of people know how diverse the different locations can be. Many people just know that they are located in hospitals, but what many don't know is that they are located in sports complexes and buildings all across the country. Okay, this is what a typical, the picture's not that great, but this is what a typical physical therapy looks like. You have the tables where a lot of the exercises happen. You have the weight machines to help you get stronger, and you have the balls and stuff. So all these help with the process. In this one, research number 2 was sometimes you have to work with kids with disabilities, and even if a patient is struggling, you have to find a way to help them get through it. For this specific article, she was working with a disabled kid, and it was hard for her because it's not as easy to say, hey, do this, 3 times, because it was a lot harder for them to do the exercises. And at the end of the day, she just wanted to see them progress good. And research number 3, the importance of having athletic trainers at school. Oftentimes, there's not enough money in some school districts' funds. And some people do not realize the importance of something until they need it. For instance, we don't realize how important our athletic trainers are until an athlete goes down with injury and assistance is needed. Rehabbing can take quite a toll on your checkbook, and sometimes spending the big bucks isn't always the best option nor the smartest. Some high schools have athletic trainers that can put you on the road to recovery. The best part about them is they are of no charge whatsoever, and most of the time they can give you one-on-one experience and treatment. However, not all high school campuses have them because they are quite costly compared to teachers and their salaries. On average, high school athletic trainers earn about $10,000 to $15,000 more than a teacher. It is sad that some schools don't offer them because of lack of money coming into the district. Every year, the importance of athletic trainers is on the rise, and it's just a matter of time before people realize how valuable they can be. They can save a life, and they can also help you on the right foot when you're trying to return to your sport or just daily activities. For me, I didn't really realize that a lot of schools don't have athletic trainers, and in Frisco IC, we were fortunate to have 2 at our school. And I've been into the clinic a lot rehabbing because it's cheaper and they're really accessible, they're easily accessible. And most of the time they're free, and they're willing to help you, recover, and they're willing to teach you things to help so that you can do it at home. And my fourth research is injury prevention. Posture is everything, and rest our bodies. I didn't realize how important resting our bodies was. And are you really as healthy as you think you are? We think that we are invincible and nothing can break us, but in reality, that is far from true. We think that since we are active and stretch and use all the proper techniques when it comes to working out, that nothing bad will occur. Although people think they are active, even working out routinely, there may be small deficiencies of movement or limitations to joint or tissue mobility. These imbalances in the movement patterns may not be causing problems at the current moment, but over time they can potentially lead to injuries that are difficult to recover, especially from age. We need to start practicing techniques that will help strengthen our muscles around major ligaments in our bodies. Techniques like working on the way we jump, the way we land, the way we cut, and make sharp turns as we run and change directions. Since women are more at risk for injury, starting to work on activities to strengthen our muscles and protecting our ligaments is crucial. It shouldn't begin once the injury occurs, but as we begin our journey as an athlete. It all starts with having the initiative to start early and protect your body while you're young and not prone to injury. For me, this is important because I wish I would have known this younger, like when I was playing sports, because you could be, 7 years old, have a sprained ankle. That sprained ankle will lead to something worse, and that injury lead to something bigger. And I'm sure everyone needs to know that technique is everything. The way we stretch, the way we, how long we spend stretching. Although we don't think it's important, it's pretty important. For my interviews, I was able to interview Skylar Richards, Coach Martinez, Coach Clark, and Kevin Otten. Okay, first, Skylar Richards is the head athletic trainer at FC Dallas. With him, I was able to see what he does on a daily basis. He sort of does sort of physical therapy-ish stuff, but he also works on the athletes' nutrition, the way they move and stuff. And then Coach Martinez and Coach Clark are our athletic trainers here at Lone Star High School. The past 4 years, I've been able to work with Coach Martinez, and Coach Clark has been here for 2 years, so I've been able to see what they do. And although I think what they do is very important, I can't see myself doing it, being in the school environment teaching, because I don't want to teach. No, not happening. And then Kevin Otten was my last interview, and he ended up being my mentor. So why I chose Kevin. Kevin seemed like a good fit with our personalities. I felt like he would teach me a lot of things I would need to know, and he's very laid back. I know with him, it doesn't have to be all formal. I feel like I've known him forever, so we laugh at each other all the time and mess around. So about Kevin. Kevin Otten played soccer as a scholarship athlete at Coastal Carolina and at the club level at the University of Oklahoma. He has a particular interest in working with post-surgical knee patients as well as patients with lower extremity biomechanical dysfunctions. Okay, so far my mentor visits, I've been able to, for my first visit, I wasn't expecting to meet a professional athlete, so that was pretty cool. The only downside to professional athletes is you can get really excited about, knowing this athlete, but you can't give off any information about the athlete, so that was hard for me. And people's experiences. A lot of people come into therapy that I talk to there, and I see them about 4 times a month, and I get to, talk to them about their life, how their rehab's going, so that's cool to see how much they've progressed, and it's fun just talking to them and connections with people. 2 weeks ago, I was able to talk to someone she just had ankle surgery, and I talked to her for about 30 minutes about her life, and she was able to teach me a lot about, growing up, when you get older, in the real world, the experiences you'll have to encounter. So not all the time in physical therapy, I learn about strictly physical therapy. I learn about the real world and what it consists of, and what I'll have to do on my own. Okay, so my research, for my skills acquired, I was able to sort of acquire public speaking, and work ethic was huge. We have assignments. We have a big packet that we get each 6 weeks, and it has about 15 things we have to do. And a lot of the times people tend to push them off and submit it last minute or late, which for me that doesn't really work because I have to get everything done on time. And has it determined which college that I will attend? Not really. As of now, I plan on attending Louisiana Tech. Okay, so my products. Originally, it was supposed to be a children's exercise book for rehabbing the knee, and then I got more specific, narrowing it down to just ACL injuries. For me, experience is everything, so I did include, my experience with my ACL injury, my friends' experiences, people I knew. And I initially just wanted to make it a book about exercises, but then wanted people to get more insight on the ACL. Here's a little thing from my book. This is one of my friends' personal experiences with the ACL. This is how it was formatted in the book. The top gives their experience, and the bottom part is their advice, so I'll just read you this one. Okay, tearing my ACL has probably had one of the biggest impacts on my life. It's most soccer players' biggest fear, but nobody ever thinks it will actually happen to them. It was more than just a physical injury. Lots of tears were cried out of frustration of not being able to play. It was difficult to stay mentally tough through rehab because it's such a slow recovery and it's mostly just baby steps the whole way. But each positive step is one more closer to playing again. Okay, so that's what she sort of went through. And the bottom is the advice she had. She said, some advice for someone going through ACL recovery would be to feed positivity into your brain and surround yourself with people. I found that a lot of the times I got upset I was by myself in my thoughts. But when I was with my friends and reading positive things, it wasn't hard to keep my head in the right place. So, like she said, reading motivational things, that also helped me as well, because every morning I would go into Google, search motivational quotes about, injury or obstacles, and that really, really helped me a lot. So in doing that, I decided to, after each exercise I put in my book, I put a couple of motivational quotes to help people and tell them, y'all can get through this, it'll be okay. Okay, so my journey. My experience with ISM was definitely an unforgettable one, but I have been pleased with the results I've gotten through this process. Unlike most, I was able to get a mentor right away. I was also able to meet some professional athletes and see what they were doing with rehab. All in all, I'm excited to see all my hard work in this class pay off. With ISM, I've learned how to make connections, how to better interact with people around me. Okay, so when I first had my ACL surgery, I found out that they had to use a cadaver because they cut my hamstring too short. So as soon as I got all the information about my donor, I wrote the donor family a letter. So I will read this to you. It says, "Dear donor family, I am sorry about your loss, but I know that they are in a better place now. Words can't express how thankful I am for the gift of your loved one's tendon. I am 15 years old and had recently gotten ACL and meniscus surgery because I tore my ACL and meniscus playing soccer. It has now been about 2 months since surgery, and my knee is feeling pretty good. I was released to walk 2 weeks ago, and I'm slowly feeling myself get stronger each day. They say I won't be able to get back into playing sports for 6 to 8 months, and that I won't be able to run until I'm 4 months post-op. I'm not going to let this injury break me. This experience will make me stronger and make me appreciate the little things in life that matter the most." For me, this letter says it all. I was so appreciative to have, someone's loved one giving up, something in them so that I could, return to normal activities. So after I sent this letter, someone contacted me, but his name was William Timmons. He is a part of the transplant at UT Southwestern, and they actually did an article over me, so I'm going to show you all that. And this was part of the poster he sent me. He came to some of my games and took pictures and videos. And this is actually on the website. It says, "New tendon reboot soccer career." This is pretty much talking about how everything happened, how I tore my ACL, how I wasn't going to let the injury, stop me, prevent me from doing big things. And it was pretty humbling to have him come up to me and, want me to talk about my experience. Part of me kind of wants to meet the donor family, but I know that's tough for them. And I was able to do a speech in the week before Easter. And it was at a convention. It's called the Celebration of Life. It's a program where donor families are there and recipients are there. So the recipients talk about, how thankful they are and talk about the importance of having donors. And they talk about, for the donors, they talk about the loved ones they lost. And I was able to actually talk about, my experience, so that was very, very humbling. I would like to thank everyone who has helped me along this journey I have embarked on, and does anybody have any questions? Nope? Okay, we're good.